Okay, once again, good morning, everyone. Welcome to CareFirst virtual health platform. And just some housekeeping issues, the sessions will be recorded, so please turn off your camera if you do not wish to be in the video. Keep your mic on mute during the sessions. You can use raise a hand if you want to say something during the Q&A period, as well use the chat box if needed. And today, we are very happy to have Dr. Christine Tang from our CareFirst Family Health team to come here today to talk about constipation, steps to achieving good bowel health. So Dr. Tang, here you go. Please, you can start share screen.
See here. Screen.
Yes, the green
Here.
button. Yes.
Okay. Can you hear me?
Yes.
Yeah.
Yes.
Okay. So hi everyone, I'm Dr. Tang and I'm a family doctor at the CareFirst Family Health Team. So it's my privilege to come speak with you for within this hour to talk to you a bit about constipation. So today we're going to mainly focus on constipation in the adult population, not in children, but next time if people are interested, I could definitely give a talk more focused on children. So you can ask me, why are we talking about constipation? Well, constipation is actually a very common problem. As a family doctor, every day I do see tons of patients coming in complaining that they're constipated, and some patient will complain, I can't pass, I don't have a bowel movement for a few days, or oh, my stool is really hard and dry, and I have to really push and it's not coming out. So it's a very common problems, and you see it in all age range, from babies to kids to adults and to like the elderly. So it is a very common medical problem. And constipation, most of the time, it's not something very dangerous. It's not life-threatening, but it does significantly affect a lot of people's quality of life. So hopefully today we're going to talk about a little bit about why people have constipation, some of the reasons, and also some of the things that we can do as to help with constipation. So you can first ask me, what's the definition of constipation? So there's no set definition. Different society have different definition what constipation is, and a lot of times what patients think is constipation is different from what a doctor feels is constipation. So there's really, I would say, overall, there's no oh, you have a bowel movement every every day that you don't have constipation. Or if someone says that, oh, Dr. Tang, I only have a bowel movement twice a week, but everything is very smooth. My bowels are the stool is very soft. They're very easy to empty. That person might not have constipation. So constipation is a number of symptoms. So people can complain when they have constipation that their stool is it's too hard or too small. They could say that their stool is difficult to pass. So when they go to the toilet, they can't really, the stool is, they take like 20 minutes to go poop because, it's very hard to get the stool out. They could say that they have very infrequent bowel movements. Generally, most of the time, it's like less than 3 times a week. If you have a bowel movement every day, but every time you go, you're pushing really hard, like you're frequently needing to strain, that could be a sign of constipation. Some people complain that they have a bowel movement, but after you still feel that your bowel, the inside the rectum, it's still lots of stool there. You feel like it's not emptied. So that could be a sign of constipation as well. People feel bloated, very swollen the belly. If you have severe constipation, some patients actually say, well, I sometimes need to use my hand to, go into my the anal area to help get the poop out, because then that will signal something like a very serious constipation problem. So you can see that there's many symptoms, and different people kind of experience different symptoms, which could all suggest there is constipation. So one way that I find very useful in telling patients whether they actually have constipation is by looking at the poop itself, the stool. So because there's a study, someone did a study and looked at a lot of people and looked at all their poop and see basically and kind of categorize the stool in terms of how it looks. So there's 7 types of stool. So type 1, type 2, 3, 4, 5, 6, 7. And they range from type 1 is like very hard and small, like little balls, to type 7, which is like water, basically. And basically, by looking at the type of stool, you can kind of see if you're constipated or you're having diarrhea. And so normally, if a normal person who does not have constipation, the poop should look in type 3 and number type 4. So I will always say, like, it's like a sausage, very smooth sausage is really good. Or even if it's a little lumpy, but, you know, very smooth, that's also normal. But if you say that, you know, Dr. Tang, my stool is really thick, like type 2, it's kind of formed, but it's really big and chunky, and it's really like bumpy, that could signal that you have mild constipation. And if you go to the toilet and you look in the toilet and all you see are these little balls that look like little rocks, or some people say they look like, you know, like little balls of poop, then that itself suggests that you have severe constipation. So this is, I think, a useful tool. Like if you're like, oh, I'm not sure if I have constipation, like every time you have a bowel movement, just take a look at the toilet and kind of see, if it's a formed and smooth, then you're pretty good. Your poop is good. But if it's like a lot of small balls and like dry and like, it means that you have constipation. So this is a very useful chart, I find, for patients. So you can ask me, Dr. Tang, like, you know, constipation, like what causes it? Because why do I have constipation? Well, constipation is usually not one cause. It's usually many factors that can lead to constipation. So it is a very complex problem, because if you imagine when you go to have a bowel movement, it's actually a very complex movement. You have to, you know, push down, and then your intestine, your colon has to move, and then your bum has to, the muscle in the bum has to relax so that the poop can come out. So it requires a lot of coordination in the muscle, and lots of like nerves involved to make this process smooth. So if anything goes wrong, then people can have constipation problem. So what are the more common cause of constipation? So I'm sure a lot of you probably heard that constipation a lot of time is really based on our lifestyle. So if you don't eat, like first of all, if you don't eat enough fiber, that can lead to constipation, because fiber itself is, you know, found in a lot of food, like vegetable, fruits, and beans, and bran, wheat. The fiber itself makes the poop at the stool more thick, so it's easier to pass. So if you don't have enough fiber, you find that your stool is very small, very dry. So it's important to eat enough fiber. So a lot of people also, is important that if what causes constipation is that if you don't drink enough water, if you're dehydrated all the time, that can lead to the stool becoming very dry and causing constipation. Another thing that's important to note, that exercise is actually a very important, lack of exercise is actually a common cause of constipation, because our body, when we move, when we walk, we move around, that actually stimulates the colon to move, and you need the colon to move in order to pass the stool. So if you see some patients that are, for instance, they're very you know, elderly, they're not feeling well, if they're not really getting up and walking, and they're like, let's say, for instance, bedbound, you find that constipation becomes a very big problem, because it's the movement itself that you need to kind of help the bowels move and pass the stool. So you know, people who are very sedentary, like don't exercise, sometimes it can cause constipation. So other than those lifestyle things, other like medical problems that patients had can itself also cause constipation. There are many causes, but here are just some examples of like some of the medical reasons why people may have constipation. For instance, there are organic cause. What we mean is that if, for instance, there is a tumor or something blocking the colon, then obviously that leads to difficulty in passing the stool, and that leads to constipation. Examples of these are, for instance, colon cancer, which is a cancer in the colon, or as well as other like tumors or cancer that lies outside the colon, which sometimes can push on it and lead to constipation. Some hormonal cause, we call endocrine cause, can also cause constipation. One is, for instance, diabetes. So diabetes is a very common, medical problem. Many people have diabetes. So as many of you might know that in people who have diabetes, if your sugars aren't well controlled, one of the symptoms you might get is that you get numbness or tingling, especially in the feet. And the reason for that is because the sugar itself can actually damage the nerves in the leg, and that leads to numbness. But similarly, in the intestine, the colon, there's actually a lot of nerves there to control the movement of the colon. We sometimes call our gastrointestinal tract a mini brain. Like it has a lot of nerves and it actually thinks for itself. So when people have diabetes, especially over long term, if their sugar is not well controlled, the sugar itself can damage the nerves in the gastrointestinal tract, and that itself can affect the movement in the colon and lead to constipation. Other common problems, hormonal problems, people who have low thyroid function, so what we call hypothyroidism. These people who have not enough thyroid hormone in their body can lead, the colon doesn't move as well, and that could lead to constipation. And common reasons also pregnancy. In pregnancy, our women's hormone changes, and that leads to slowing of the colon movement and constipation. And as we said before, there are actually neurological causes, like nerve problems, that can cause constipation. So we kind of just said that the colon, like the intestine has a lot of nerves, it's like a little brain. So if any medical problems that potentially can affect the nerves can itself also lead to constipation. One common disorder is like Parkinson's disease. Parkinson's disease, as you might or may not know, it's actually a neurodegenerative disease. So it affects the nerves and it causes the degeneration. So, people from Parkinson will find that, they're not walking as well. They may very, very stiff. Now, those are nerve problems. But at the same time, the nerves in the gastrointestinal tract, our colon, can also get affected. And so people who have Parkinson's many times find that constipation is actually a very big problem. And it really affects their quality of life. So that's why in Parkinson, there's a nerve problem. So that's why you get constipation, as well as people who have spinal cord injury. For instance, so a patient may have had a car accident and damaged part of their spinal cord. And with that, they can lead to constipation because, the nerves that control the colon is affected. And finally, myogenic cause, which are like muscle causes. So people who have, let's say, mild tonic dystrophy, which is kind of a disorder where your muscles shrink and they don't work well, because the colon itself is actually a big tube of muscle. So if there's any medical problem that caused the muscle to degrade, then that can affect, that could lead to constipation. So this is only a very short list of the potential medical problems that can cause constipation. And obviously there's many more that we don't have too much time to talk about. But, so when you have a medical problem, that can itself lead to constipation. But many times it's also the drugs that were prescribed to help with the medical condition itself can also lead to constipation. So there are many drugs that can cause constipation, and here are just a list of a bit more of a common ones that can lead to it. For instance, pain medications, particularly medications that contain morphine-like painkillers. So we're like, for example, like Tylenol 3, Tylenol 2s, Percocets, hydromorphone, morphine. These are all very strong painkillers. And one of the side effects they have is that they do cause severe constipation. So if you ever had these medications before, you'll note that a lot of times the doctor who prescribes these strong pain medications also gives you a medication to help with constipation, because the pain medication itself can cause constipation, which could be very uncomfortable. Other drugs are like antacids. So if you have like heartburn, some antacids containing aluminum can cause constipation. Iron supplements are very common. So, iron supplement, a lot of people take iron supplement, for instance, if they have anemia, low blood counts, that because it's due to lack of iron, they take a supplement of iron. And a lot of times patients tell me, Dr. Tan, I can't take these iron anymore because I can't poop. I can't have a bowel movement because it's so hard and dry. And so that's why iron itself can cause it. Certain antidepressants can cause it, as well as diuretics. So diuretics are examples are like Lasix. It was just a water pill that I know a lot of elderly patients usually take. If, for instance, they have heart failure, kidney failure, they have too much water in their body, sometimes they take water pill to get rid of the water. But if you take out too much water, that can lead to the stool becoming dry, and that can lead to constipation. So you say, Dr. Tang, yeah, now I know like maybe some of the reason why I have constipation, but I'm really interested in what can I do? Like, is there anything I can do to help with it? And there are lots of things that the people they research on what can actually help constipation. So the simplest and the safest thing is, as I kind of said before, if you don't drink enough water, you can have constipation. So it's important that unless you have certain medical problems, you can't drink too much water. It's important to drink enough fluids every day. So where the amount suggested is 8 to 10 cups of water or other liquids a day. Okay. Also important is that to remain physically active. So we suggest, if you can, any kind of physical activity would be fine, but 30 minutes a day would be ideal. So whether that's walking, or if you have a bike, or hopefully when the pandemic's better, people love swimming and going to the gym. All those things, half hour a day of regular physical activity helps the bowel move, the colon move, and that helps with constipation. So I even suggest, like, sometimes I have elderly patients that, they're very frail. I still suggest them, you need to get up, every single day to walk around. If you find it difficult, you can always kind of start slow, maybe walk for 10 minutes or even 5 minutes, take a break, and then maybe walk 5 minutes later in the day. And if you do that little by little, you can actually, throughout the whole day, it does add up to quite a lot of time, and it does help with the bowels moving and avoiding constipation. So fiber is also a very important thing to help with constipation. As we said before, lack of fiber is a common cause of constipation. So fiber, there's actually two types of fibers you may have or may not have heard of. So fiber is divided into two types. So there's the soluble fiber and the insoluble fiber. So soluble fiber is actually a type of fiber that dissolves in water. So if you have those fiber, you put some water, it actually dissolves, and it actually forms a jelly-like material, like a gel. Versus the insoluble fiber, which is another type of fiber, it really doesn't dissolve, and really it's just like more like almost like cardboard, like wheat bran. Like, it's just it doesn't dissolve. You put water, it doesn't dissolve. So fiber, there's two types, and both types is actually important to important for our bowels to move properly. So the soluble fiber, as I told you before, it forms a gel. So if you imagine, if you eat more soluble fiber and your poop is more jelly and more smooth, then it passes easier because it's almost like a lubricant. It's more smooth. Versus if you and so that's important, the soluble fiber. So insoluble fiber is also important because it doesn't get dissolved, but it bulks up the stool, so it makes it bigger and thicker. And in the colon, in our intestine, one other way it actually how it stimulates to move is that if there's any stretching in the colon, it actually triggers it to move. So you imagine like a tube, and if you stretch it, it moves. So if you have more fiber in your poop and the poop is bigger, it actually stretches the wall in the intestine and the colon, and that stimulates movement and passing of the stool to avoid constipation. So you can see that in a diet, it's important to take both soluble and insoluble fiber. And the daily total of fiber intake for the day, soluble plus insoluble, is about 20 to 25 grams a day. But some people, you know, might take 25 grams and they're like still having constipation. So that person might need a bit more or, you know, or less. But this is a ballpark, I'll say about 25 grams a day. So you say, Dr. Tan, how do I know how much fiber is in my food? Like, I have no idea where to look for it, and how can I calculate this? Well, you know, like, I think it's really you don't really need to calculate it. I mean, like, the whole idea of the fiber is really to kind of try to incorporate food that have a bit more fiber into your diet. You know, so food that have higher fiber content will be like fruits, vegetables, whole grains like wheat, bran, and beans. Beans also have a lot of fiber. But, you know, so if you don't want to calculate, you can always, you know, incorporate more of these foods into your diet. But if it's like, Dr. Tan, I really want to count know how much fiber I'm taking, just so that I know, like, if I'm getting enough. So how can I find out? So one way you can find out is if you look at this right side, it's like the food label. So if you buy, like, let's say an oatmeal, a piece, you know, buy some bread, on the bag, there will always be some kind of a little box like this with nutritional facts. So you can take a look at the you know, package, and it will tell you the serving size, which is basically how much you have to eat. For instance, this part is like half a cup. If I eat half a cup of this item, the dietary fiber I'll get from this item is about 6 grams. Right. So if you, let's say I ate 1 cup of this, let's say oatmeal thing, 1 cup of this, then I would have 12 grams of fiber. So the package itself will give you like some idea of how much fiber is in that type of food. So when you go buy at the supermarket, if you're not sure, it's like, should I buy the white bread or the brown bread or the wheat bread? How much difference is the fiber? You could take a look at the package. The white bread, you'll see the dietary fiber is actually very low, versus the whole wheat one might be higher. And even the ones where, let's say, pumpernickel, they might be even higher. So, you know, by learning how to read food labels, it can help you in a way kind of decide which type of food is better for constipation. So here I just put some examples of common foods that you know, people eat, and just to give you a ballpark of how much fiber is in it. So for instance, we're looking at the apple with skin in it. It's about 3.5 grams of fiber. I just want to give you an example. It's like, for instance, the same apple, if you squeeze the juice out, don't eat the skin, don't eat, like, you know, actually the fiber. You just squeeze all the juice out. 1 cup of juice is only 0.74 grams of fiber. So I always tell my patient, you know, don't try not to drink the juice. If you like things like liquid, just make a smoothie with the, you know, to put the whole thing in, because that you incorporate the fiber into the drink. Versus if you squeeze out the juice and they take out all the pulp, all the skin, basically there is minimal fiber in these in juice. You know, like, for instance, banana will have 2.5 grams, orange is 2.6, green beans, 1 cup will be like 3.4, like a broccoli, like a stalk of it, 5 grams. Peas actually have a lot. So like those little green peas that sometimes you see in the frozen package, 1 cup of it is 7.2 grams. Beans have a lot. So, you know, like cooked beans, like the kidney beans, half cup will be like 7.4 grams. Oatmeal also has good in fiber. 1 cup of cooked oatmeal is about 5.3 grams. Rice itself, brown rice is 1 cup is about 2.5. And just to give you an example, a white rice, the same size, will be 0.6 grams. So I know a lot of, you know, people like rice, and especially in the Asian population culture. But, you know, I always, you know, suggest, like, if you can, try to eat brown rice, because, you know, because the fiber content is just that much higher compared to white rice. Because in white rice, it's white because a lot of the fiber, the shell, where a lot of the nutrients is actually removed. So that's why it's white in color and very like soft and tasty. It's because it's lacking a lot of the fiber. So if you had a choice, try the brown rice. So I always suggest patients, like, there is some patients get super excited, or like, man, I need to increase my fiber now. I want to get better, my poop, get my stool better. I'm going to eat lots of fiber. And then next thing you know, 1 week later, they'll call my office and say, like, Dr. Tan, I can't eat fiber. Like, I get so gassy. I don't feel good. I'm bloated. You know, it's important when you eat fiber that your body has to get used to fiber as well. So when you try to increase fiber in your diet, it's important to do do it slowly, not in a rush, because you can imagine your body's used to eating all this non-fiber food, and suddenly you eat like tons of fiber in there. Your body's just like fighting a war. It's like, I don't want this. It's, and you get gassy and bloated and uncomfortable. So it's important to go slowly, incorporate slowly over weeks, and you'll see that people do get less of those side effects from fiber, which is usually the bloating, the gas, and things like that. So I just took this moment to kind of talk about prunes as well, because prunes is actually a very a natural food item that actually can help with constipation itself. So there are studies that show that if you eat like even like 10 prunes, which are these like black, dry plum things, 10 prunes can actually already improve the number of bowel movements and the consistency of the stool, meaning the stool, you'll have more poops and they're easier to pass. So why do prunes work? So prunes work mainly due to two reasons. One, they're very rich in insoluble fiber. So these are the fiber that don't get, they don't get absorbed, so they make the poop bigger. So if you eat like a cup of prunes, it's already like 12, 13 grams of fiber. So lots of fiber in it. And also they're very sweet. So they contain a sugar called sorbitol. Sorbitol in prunes, like when you eat it, actually the sorbitol doesn't get absorbed well into our body. So it stays in the colon. And what happens then when it stays in the colon, it actually draws water in the colon, and that stretches the colon. And as I talked to you before, stretching of the colon is important to promote movement of the intestine. So then, with the prunes, that's one way that it actually helps constipation. So, if you have occasionally mild constipation, you're like, oh, I don't want to take any like other medication. I just want to try like eating certain foods to help. You could try to take some prunes. The only thing to be aware of is prunes are very sweet. So, so if you have any kind of blood sugar issue, just to be aware of it and not go overboard and eat too many, and you'll notice your sugar going too high. But it's a good way to promote to treat constipation. And some kids, if you hear, like kids usually drink some prune juice because they don't like eating prunes. It's kind of like not that tasty. So a lot of times in little kids, we often tell them try prune juice, and that again, it does. It's the sorbitol, the sugar in the prune, that actually helps with the movement of the stool. So what are other things you can do other than diet things like an exercise? Well, one of the things people know is that the best to have a regular set time to have a bowel movement is very important. It becomes a habit. So for instance, the best time actually they find that to have a bowel movement is actually after breakfast and within the first 2 hours of waking up in the morning. So let's say you wake up at 8 a.m. and then you have breakfast at like 9 a.m. The best time to have a bowel movement will be something like 9:30 or 10 o'clock, right after breakfast, but within some 2 hours of your awakening. And they did studies and looked at that time, actually the colon itself is moving the most, and you want to kind of catch that time to have a bowel movement because you need to have the colon moving in order for the stool to come down and poop it up. So you have to. So I always suggest patients who have constipation, why don't you try to establish a habit of going to have a bowel movement in the morning? So I would say, like, after breakfast, why don't you go try to have a bowel movement, even if you don't feel like you have to, and try to sit on the toilet for a few minutes, because a lot of times the feeling of that you have to poop is not very strong, and it's only when you relax, you have nothing else to do, that you can suddenly feel it. So it does help. Like, so when people sit there and they have nothing else to do, like, oh yeah, I do have to have bowel movement, and then they pass it, and then if you do that every day, it becomes a habit, and then you becomes a more of a regular bowel, then you have more regular bowel movements. The other things that's important is that having a bowel movement is actually, you need to be very relaxed. If you ever try to be in a rush and you try to go have a bowel movement, you notice that you cannot go because there's these nerves that it's only when you relax, you stimulate the colon to move. So if you're very stressed out, you're like, I have to go to work, or I have to pick up kids, or I have to go to a doctor's appointment, you'll notice that you cannot have a bowel movement. So it's important every day to allow yourself some time. Don't rush. So, in the morning, like, wake up earlier, just give yourself a time that if you do need to have a bowel movement, make sure you have enough time. Don't rush it. And it's important not to ignore the urge to have a bowel movement. Because sometimes I hear people say, oh man, I'm doing stuff and I was like, oh my God, I have to have a bowel movement, but oh my God, I can't. I'm late for work. I have to go to work. I'll go later. It's okay. It's fine. But then the thing is, the more you ignore the urge, the signal then becomes weaker. So then if the first time you're like, oh, I have to go, and you didn't go, you notice the next time you feel an urge, it might be a few hours later and might not be as strong. And if you ignore that one too, then the next one might be a day or two later. And so the more the stool stays in the colon, the more constipated you get. So basically the bottom line is that if you feel the urge to go have a bowel movement, make sure you go right away. Don't wait. If there are things that you can say, okay, I can afford 5 minutes, just have your bowel movement but don't try to ignore the urge, or else, you get constipation. So positioning, it's something I also some people don't know about. It's like, what's the best position to sit on the toilet to have a bowel movement? So actually in evolution, if you think about how people millions of, these years that people evolved into humans, most people have a bowel movement by squatting, like do a squat and poop, right? Back like 200 years ago, they didn't have toilets. So it's only modern people have toilets. And actually sitting on a toilet to have a bowel movement is not the best position. And the reason for that, if you look at the picture here, this is a person who's sitting in a toilet. And if you look at the colon here, which is this kind of like sausage-like thing, there's actually a muscle called the puborectalis muscle that kind of, it's like a sling, and it pulls on this rectum area, this rectum area. And basically you're sitting, you see that there's a bend in the rectum area. So if you imagine you go and poop, you're going in a bend, right? So it's not very smooth. So what happens is that they find that if you have to go on the toilet, you can use a little chair, a stool, to raise your knees up so that it's above the hips. So you get this angle, almost kind of making it similar to when you're squatting. See, for instance, when you're squatting, your knees are above your hips. So this is kind of mimicking squatting. So you have put a chair, and then you lean slightly forward, and then you use your hand to support yourself. And then you notice here in the picture, you see when you position your knees up, you're actually, this muscle relaxes fully, and then your rectum is actually straightened up. So people find that if you have a bowel movement using this position, it's easier for the stool to pass, because you don't have to have an angle. It's more smooth and more straight. So this is something that you can try. Like when you're at home, when you have going to a toilet, you could take a look. Is my knee really low or is it high? And it's an easy fix, because you could just put a little chair under your feet and help with the positioning, and see if that helps with your bowel movements. And then, so other than, you say, lifestyle things, like what are other things? Like you say, Dr. Tang, I tried all these lifestyle things. I drink water, I eat fiber, I try to go regularly, but it's not working. So what else can I do? So one thing is, as we said before, medications itself can cause constipation. So sometimes I suggest you go back to your doctor and take a look at the medications. Is like, sometimes, certain medication you need, so you cannot stop, but there might be some medications that you might not need, or maybe the dose can be changed, or there might be some alternatives. And sometimes going through the list and seeing potentially which medications may be causing a constipation is important, because then that's the core reason why you may be constipated. So I encourage you to kind of maybe talk to your doctor and see if this could be a possibility. Okay, so basically you did all that, and as I said before, sometimes you do all these lifestyle things and you try everything, but you still constipated. So what can you do, right? So that's when laxatives come into role, right? So laxatives are these medications that actually help you have a bowel movement. So there are a few different types of laxatives, and I'm going to just briefly kind of talk to you about the different types and some examples of these laxatives. Okay, so the safest and probably the safest and the the safest one to use long term is called a bulk forming laxatives. An example of this is like meadow miso. Okay, so I'm sure many of you probably seen this at the pharmacy. It's a big orange bottle, and inside essentially is fiber. Okay, so these laxatives, bulk forming laxatives, essentially they make the stool bigger, and most of them are basically fiber. So whether the fiber is, which type of fiber it is, it depends on the brand, but essentially it's fiber, and it helps make the stool bigger so that you pass easier. Okay, so but so these are safe to take long term. So if some people who, for instance, kind of eat a diet, but they're not able to eat that much fiber in the diet, sometimes taking a meadow miso or like a bulk forming laxative on a daily basis can increase the fiber and make the bowels run more smoothly. So it's worth a try. Some of the more common side effects of this is that a lot of people do find bloating, like gas, cramping after they take this fiber. And again, as I said before, fiber you have to increase slowly. If suddenly you go from no fiber to 100, like tons of fiber, you're going to get gas. So if you try this miso and you feel a little gassy, it's always okay to cut it in half or even a quarter, and then see how you feel, like kind of build up to it. Because most of the patients who stop using these fiber drinks, which is the safest laxative, is because they have gas. And that's something that, with patients, it will slowly get titrating it up, we can avoid some of these side effects. And one thing I wanted to mention here is also that a lot of people don't know that when you take fiber, especially these bulk forming laxative, it's very important that you follow that direction properly and add enough water. Some people are like, I can't drink this whole cup of water. I'm just going to add half water. So essentially, if you don't drink enough water with the fiber, it can actually worsen the constipation. So because you imagine fiber is like these, kind of like very fiber, and if you don't have water, it doesn't bulk up. So you're basically blocking your intestine. So people can have some obstructive symptoms and if you don't drink enough water. So if you take fiber, make sure you drink water. It has to be like that. So I see this commonly like elderly patients who can't drink a lot of fluid. So that might not be the best laxative for them if they can't drink a lot of water, because it might make the problem worse. So another type of laxative is called stool softeners. A common example of this is the doxystate sodium, we commonly call cholase. This is very safe as well. And how it works is it basically decreases the surface tension on the stool. So usually our stool doesn't absorb water that well, but when you take the doxystate, it basically decreases the surface tension and allows more water to be absorbed into the stool, and that softens it. And a lot of people feel that when the stool is softer, it passes easier. So that's how it helps with constipation. So other forms of laxatives are called osmotic laxatives. So examples of osmotic laxatives would be like polyethylene glycol, we call more commonly like Restoralax, lactulose. There's magnesium hydroxide, which commonly called milk of magnesia. So how these work is that basically how you take these laxative and they don't get absorbed in our body that well. So it stays in the colon, and how it works is it draws water into the colon, which stretches the colon, and that causes the movement of the colon passing up the stool. So it kind of works similarly to prunes. When we talked about prunes having sorbitol, that doesn't get absorbed. And essentially prunes in a way work like it's an osmotic laxative as well. So these are also relatively very safe to take. So Restoralax, lactulose, and magnesium hydroxide. So another type very commonly used are called stimulant laxatives. And you might have seen, your doctor might have prescribed it, you've seen other people take it. Common one are Senokot, which is like a brownish, greenish pill like this, or Bisacodol. And essentially these products, stimulant, as you could tell from the name, they stimulate the colon. So they kind of irritate your colon and kind of tell it to move. So let's say your colon's not moving and you're kind of tickling it and just say, go, move it. And then it moves, and then that promotes the bowels to move and prevents constipation. Okay. Finally, other categories are like suppositories and enemas. So so all the other ones we talked about are oral, so you take by mouth, but sometimes people can't take things by mouth, or they might be so constipated that things by mouth don't work. So then they comes that they might need a suppository enema where they put it into the rectum, directly in from the anus into the rectum, which helps with passing of the stool. So examples of these are like glycerin suppository, bisacodyl suppository, or you hear about like fleet enema, water, tap water enema. These are all things that you put into the rectum that promotes locally the stool to pass. So you say, Dr. Tang, oh my God, there's so many laxatives, and like, how do you even choose which one to use? And like, how do the doctor decide which one is better for me, or which one, if I go to a drugstore, I see a whole shelf of constipation med. How do I know which one to pick? Well, I think it's, I think it's always a good time to chat with your doctor to make sure with them. But if you can't tell, I could tell you some like general things that might help you decide. So one of the things that's important to note is that laxatives, how long it takes to work, it differs between different laxatives. So for instance, the enemas and suppositories, which are the ones that you actually directly put into the rectum from the bum, that works really fast. So you're looking at a lot of people within like 15 minutes or within an hour, they get a bowel movement. Versus stimulants, like something like Senecot, it takes hours. So like a few hours, like 6 to 12 hours to work. And we're looking at the bulk forming laxatives, like Metamiso, stool softener, like Colace, or osmotic laxatives, like for instance, lactulose, Restorelax. These takes a few days to work. So if I have a patient who tells me, I haven't had a bowel movement for a week and it's really uncomfortable down in my bum area, I need to get it out, I would suggest them using an enema or a suppository, because that gets rid of the stool quickly within an hour. Versus someone who's like, I can't, I'm not, they have a really bad, need to get the constipation under control, and I haven't had a bowel movement for a few days, but they're like, I am not putting anything up my bum. I am scared of that. So they might benefit from something like Senecot, because Senecot, yes, it's not within an hour, but it's not bad. It's a few hours. And usually people take it at bedtime, and by the next morning, they'll feel that they have a bowel movement. So stimulants are very useful, and it's an oral pill. It's not like, I drink lots of, water with it. So a lot of people do like Seneca for occasionally like constipation problems, because it does work fast, and it doesn't take too long. But if you have a patient, for instance, they're like, oh man, Dr. Tang, I have a chronic constipation problem. My stool is always on the dry side. It's kind of hard to pass, but it's not something like I'm blocked up for like a week. I have time. Like I just need to get it softer, so I don't have, it doesn't become a problem where I can't poop for like a whole week. So then those patients, then we can think about the other ones that take a few days to work. For instance, the fiber, the Metamiso, the Colace, the Restorelax, you have time, right? And so these take days to work. Generally, I would say like the safer types of laxatives would be like fiber is always the safest, the bulk forming laxative. Colace is safe. Osmotic laxative like Restorelax and lactulose are also very safe for long-term use. But things like Seneca, which are stimulants, there are some theories that if you don't want to kind of use it over long term, because sometimes that does lead to the bowels becoming a bit dependent on the medication. So just take this time, just a minute, to kind of chat about probiotics as well. It's a newer area of research, and to be honest, there's not a ton of research studies done. Most of the research studies looked at probiotics in helping constipation. It has been very small studies and not very well controlled. So, take this with a grain of salt, like whether it does work. But with, they looked at a few studies that, done pretty well, and they kind of looked at whether taking probiotics does help with constipation. And the conclusion they did is that it may help with constipation. And there's a few studies that show that, the probiotic does, make, people have more bowel movement. It's more smooth. And so it may help. So what I would suggest is that, it's something worth to try if, some people want to go a bit more natural, like, so you could take some probiotics, supplements and things like that. But, another easy way is really try to, if you like yogurt, to kind of try like some yogurt, like Activia or Dan Active. These are probiotic yogurts that, sometimes a lot of patients have told me that, taking this regularly can regulate the bowel movement, and they're very safe and healthy. So I think it's something that, if you want to try, you can definitely give it a try. So on the final slide here, I just wanted to kind of go over some red flags for constipation. Because when we read red flags, so most of the time constipation is just constipation. There's nothing life-threatening about it. But occasionally there are other signs that could suggest that something more serious is going on. So for instance, as a doctor, if someone tells me, oh, Dr. Tang, I have constipation, give me some laxative. I was like, no, wait, let me tell me what's going on. And then I might ask some of these questions. For instance, do you see blood in the stool? Did you ever test your stool for that? Like, for instance, the FIT test, which is the colon cancer screening test. Have you ever had a positive FIT test? Do you have obstructive symptoms, which means that basically your colon's blocked, like you can't, that you feel like you're not farting, you're not passing gas, you're obstructed. So that could be serious. If someone tells me I never had constipation my whole life, suddenly no change in my lifestyle, no stress, and suddenly I'm constipated, that could be something, there might be something going on. So I might be asking them a bit more questions. If you have severe persistent constipation that's not responsive to treatment, for instance, you take a few laxative, it's still not working, that could signal something more serious. Weight loss, right? So if you start losing weight or you change in stool caliber, meaning like, usually it's very fat, your stool, and now it's coming like a pencil, like a pen like this, then that could suggest something blocking the colon, and that could be something serious. Or if you have a family history of like, say, colon cancer or like inflammatory bowel disease, those could all, suggest that there might be more going on than constipation. So I think it's important here is really to see, like, if you feel like, just have normal constipation, if there's anything different about it, or if you're worried about anything, definitely you need to go to see your doctor and get an examination and see what's going on. Okay. So at the